So first of all, good afternoon. It's a pleasure to be here with you. Thank you for inviting me to tell you about the story of Sheba Medical Center and ARC, and specifically our goal to redesign healthcare and transform healthcare towards the year 2030 and beyond. And of course, I'll emphasize our work in precision medicine, which is one of our strongest focus points. So of course, very briefly, just to mention Sheba Medical Center, largest health system in Israel, largest in the Middle East. It's actually one very large campus, which is a small city. I invite you all to come and see. It's not a typical hospital. On one campus, we have basically all the aspects of care, from acute care to post-acute and rehabilitation. The numbers are quite large, with about 2,000 beds, 10,000 employees, 12,000 babies delivered every year. So a large hospital by any standards. But also very strong in terms of data, completely digital and completely paperless going back more than 20 years, with many of the systems being electronic all the way in the 90s. And that, of course, allows us to use the data to improve care, and which is something we've been doing and have served as an example to many other places in the world in terms of leveraging data and leveraging the analytics to improve care. Ranked by Newsweek magazine as one of the top 10 hospitals in the world for the past 4 years. And of course, we're very happy and proud about that recognition. But another role that Sheba has taken, and this was in 2018 when I started my role as Chief Innovation Officer at Sheba. I was the Chief Medical Officer there for a few years before, was to try and understand what is the ultimate role of innovation. And you know, many times in universities, sometimes we see innovation as a way to commercialize our intellectual property, to take the research outcomes to the market. Well, we thought that this is not enough. What we wanted to do is have a concrete effect on what the future of healthcare would look like, be able to impact the world in that regard. So before you set out to change the world, to redesign healthcare or transform healthcare, regardless of what word you're going to use, you need to first of all agree on the vision. And so we've put together a group of international organizations that started in 2018 to meet. We first called it the Future Hospital, but we understood very quickly that it's not about the hospital, it's about the system. And so we changed from Future Hospital to the Future of Health, FOH, now including about 50 organizations from around the world getting together virtually and physically. We have our next summit in Israel coming up in a month from now. And actually putting down a blueprint for what the future of health needs to look like. We publish publications. New England Journal of Medicine is one of the partners, so you might see from time to time a publication on the New England Journal of Medicine from this very prestigious group. But now that we have a vision that we have put together, and obviously when we talk about transformation over the next 10 years, we talk about these areas as telemedicine, which we've seen the effect that had already in COVID, and obviously we understand it is a main transformation vehicle, but also artificial intelligence, but also virtual reality, augmented reality, robotics. All of that will have a great impact on what the healthcare would look like 10 years from now. It's great to have a vision. You know, it's even fun to get together and brainstorm about a common vision. It's not always easy to agree because there are different views, as you know. But to take that vision and to turn it into reality, we've actually built ARC. So if FOH, Future of Health, is the vision, ARC is the execution. And we all agree that execution is much more difficult than setting a vision. So how do you take that vision and actually make it happen on a global level? And this is what ARC was built to do. To understand how it's possible to even think about this, we had to come up with a very concrete strategy. And the strategy had 4 parts to it. The first one was focusing on digital health. Regardless of whether you're a big fan of digital health, we all understand that digital health is going to transform healthcare, much like many other industries. Think about the banking industry 20 years ago and how it looks today, where we do everything through the app or through our desktop. This is what's going to happen to healthcare. So digital health is going to be a focus, and we'll see in a second what is the broad spectrum of digital health. Number 2 is open innovation. Not only working internally to create innovation from within, like many other universities or academic medical centers, where the focus is to create innovation from within, But if you're going to transform healthcare, you have to be constantly looking out. You have to constantly find the best innovation that exists outside of your walls and bring it in. And so open innovation is critical if you're going to redesign, if you're going to transform your own organization, adjacent to working on internal innovation, or what we call organic innovation. So having the two together is a critical piece of ARC. The third is international collaborations, and I don't need to tell you why that is important. If you're going to transform healthcare on a global level, you have to work with global partners, and you have to find the best partners, period, regardless of where they are geographically, because geography, as we all know, is no longer a barrier. I talk with my partners in Australia in the morning, and then I would talk with my partners at Sheba, probably through Zoom as well, because going across campus is 15 minutes we can save. So as we understand, the world has become very small. So we need to find the best partners to work with. And then finally, it's building a structured approach to innovation. We think innovation is not this magic that either happens or doesn't. Innovation is a structured methodology that you can implement. And we have been doing this over the past couple of years. So when we talk about digital health, we're looking at the wide spectrum, as you can see here. And of course, precision medicine is a very central area that we're focusing on within ARC to actually see the future of health transform. But that, of course, is together with big data and artificial intelligence, which, of course, works hand in hand with precision medicine, telemedicine or remote care. Where do we see telemedicine go over the next couple of years? It's not going to remain virtual visits where we do video with our doctor. This is, of course, no longer innovation. Where do we take digital health and telemedicine next? I can talk a lot about that. We won't have time. Virtual reality, augmented reality is transforming healthcare already. It's going to have a major effect on what healthcare is going to look like 10 years from now. And looking at medical devices, but more from the angle of smart devices, devices that produce data, like sensors, wearable sensors, Internet of Things. This is going to be a major revolution as well, as we turn the home environment into a health environment and collect much more data for precision medicine as well. I'll mention it very briefly in one of the examples. I won't have time to explain to you again the whole idea of open innovation, but again, how do we look outside? How do we constantly scout for innovation and identify the right one to bring it into the system? You have to have a team that is focused on doing that. This is something most organizations are missing out on. We typically look at startup companies or the industry as somebody that is looking only to make money on the expense of our hospitals or institutions. We have to change that. We have to look at the opportunities that they present and try to leverage that. It's not easy. You have to find the right models to do that, but we think it's critical to make that happen. We have about 80 startup companies that are ARC members. You see them here on the slides. I'm not going to go one by one, but of course, many of them are transformational in what they do, and anything from precision medicine, and you'll see an example in a couple of slides of one of those startup companies, to artificial intelligence, to medical devices, and so on and so on. And I can tell you many of these companies are changing the world as we speak. Of course, partners. You need the right partners. So ARC is a global ecosystem with 120 members around the world. You can see some of the institutions that are ARC members. There's a strong focus on North America, especially the US. With Mayo Clinic, Mount Sinai, Cedars-Sinai, Mass General, Henry Ford, Thomas Jefferson, many famous institutions. But of course, as we know, the world is not just the US, and we're constantly looking for the right partners elsewhere, like Karolinska and Charité from Berlin have just joined as well. So this is ever growing. And again, we're looking for the right partners to work with. There's a huge amount of work that happens with the names you see here. It's not about having a logo on a slide, but it's really about concrete work, concrete innovation, concrete research that happens, co-development of new solutions that we pilot together and even take to the market together. So this is critical as we move into the future. And of course, the industry. I mentioned industry is an opportunity. We saw it during COVID. We couldn't have gone very far without the help of the pharma companies with the vaccines. But we think this is something to be leveraged. And again, we work with some very big names and others that are looking to join. And again, this is not about us, for example, providing data to the big industry. We don't actually do that. It's about collaborating on co-production on co-innovation, on creating new solutions, and there are multiple examples I could provide if I had more time. And finally, it's the infrastructure. Infrastructure is not just the physical space. This is where we are currently. You're all welcome to come and visit the ARC Center. But it's also about the data infrastructure. We've had a huge amount of work done around what is the appropriate data infrastructure for the future hospital. And this is something we're very much focused on. It's also policy and regulation. How can you impact your own policy internally, but how can you impact regulation that is coming from outside? I didn't mention Sheba is a government hospital, so of course we work very closely with the regulatory bodies in the Ministry of Health, Ministry of Finance, Ministry of Justice, and so on and so on. And we have great impact on regulations in the country of Israel. And also the funding infrastructure. How do you fund innovation? We all know it's a challenge. Just like funding research, sometimes even more difficult. And so what is the right way and approach to get the right funding to take this to the next level? This is our next building, by the way, so if you'll come after 2025, we'll host you in our new home, which would be 22 floors high and about 100,000 square meters, a bit larger than what we currently have. We don't need all this space for ourselves. We build it so large because we want our partners to come into the same building with us. You saw the partners on the previous slides, and I can tell you, for example, that Mayo Clinic and Thomas Jefferson from Philadelphia are actually going to open up laboratories in this building to work in one space so that collaboration can actually be taken to the next level, and this is a great opportunity. So when we talk about precision medicine, and I think this slide is probably fairly well known to you, but we look at the multi-omic universe. This is no longer just genomics. This is what we do at ARC. We look at the really broad spectrum of multi-omics from the databases at Sheba going back many years. We have strong databases in microbiome, in strong databases in patient-reported outcomes. We've had about 70% of our operations and clinical conditions, we're collecting patient-reported outcomes on going back for about 10, 12 years. So looking at all this data and bringing all of that into one common cloud allows us to then use analytics and then, of course, take that to serve as decision support for our clinicians. I want to show you one example because we won't have time to look more than one, but of course, happy to follow up with people that are interested. And this is specifically in inflammatory bowel disease, in IBD, where we have looked at very different sources of data from our patients. Anything from, of course, clinical data, but also data coming in from the imaging, data coming in from pathology, data coming in from patient-reported outcomes that is reported by patients through an app. Taking all that data in, and this is another interesting piece, what we've added is data coming in from the video capsule. You're familiar with the video capsule we swallow. That typically produces a video of about 6 hours. And who's going to watch that movie? Very interesting movie, I might say. The gastroenterologist, right? They're going to sit in front of a 6-hour boring movie and see if there's a polyp or an abscess. So, we can have artificial intelligence do that. So together with one of our partners called Intel, you heard about them, they brought in data scientists that we don't have that capacity. We brought in our data scientists and our videos, and we created a solution we're now using at Sheba. Any gastroenterologist, before they sit down in front of the movie, they actually have already a report of what the AI has found in terms of polyps and ulcers and so on, and exactly at what level the findings were found. And so that helps the clinician make better decisions and prevent mistakes. Maybe in the future, we won't even need that clinician because the report will be very, very accurate. We think this is where this is going to go. So all of this data is coming in together, and we've created this new score that actually is much more superior to predicting deterioration of IBD patients, to predicting exacerbations of the disease, much more accurate than even using calprotectin, which is, as you know, what we use today in stool for those patients, and the kit costs quite a lot. We don't need that today. We look at all the data coming in, we have a better way, and this is just the beginning. We'll probably have better results moving forward. We're adding another omic, which is digital data from the patient. We have all of our IBD patients that agree to this, not all agree, have a watch that measures vital signs, and we collect that data as well, and we use it, again, to improve our decision-making, improve our prediction to be able to see where the patient is going clinically. And the last example, this time not Intel, a large company, but a startup company called Imagine that is doing digital pathology, looking for AI solutions on the imaging of digital pathology. We have a completely digital pathology lab. So now we're ready to start using some AI insights. So what we've done here, and this research was published and was just also presented in one of the conferences in pathology, where we look at lung cancer. And we find out through the image, we find out the exact and specific mutation. As you know, this is critical for us to understand what treatment to treat those patients. But instead of waiting 4 weeks to get the genetic results, which is typically what it takes, within 10 minutes, we have an algorithm that says whether this mutation exists or not. We've worked it into the workflows. So currently, we're not letting go of the traditional genetic testing. We're still doing the genetic testing, but we work this into the workflow, and this is already in use with our lung cancer patients. And we have many other models that we're now working on, and this is a collaboration, as I've mentioned, with a startup company. But also we're taking digital pathology to the next level, and we think this is where it needs to go. We call it pathoradiomics, where we blend together two worlds, very different, radiology on one end and pathology on the other hand. You bring that together because both are digital, as you know, and we can have insights that one day we think we'll be able to avoid the need for a biopsy because we'll be able, through the radiology, to get everything we need, and we won't need to actually have the tissue diagnosis, which sometimes is more complicated. So this is what we just actually launched our pathoradiomics lab about 6 months ago. So hopefully very soon we'll have something to show for that. So this is the whole ARC network. As I said, 120, getting close to 130 members around the world that are working together in synergy around these projects. I showed you a little teasing of what the work that we're doing. There's, of course, much more. And we think that only working in an ecosystem like this one, only as we work together with the industry, with the academia, with the startup companies, the brightest ones, we're able to actually take transformation to the next level and actually make that vision of the future of health happen. So with that, I'll end. And of course, if there's time, I'm happy to answer any questions. Thank you.
Thank you, Eyal, for a fantastic presentation that showed us how science fiction can become reality. And thanks for raising IBD as your example. That is really a public health problem to that extent that the European Commission is just about to recommend public screening for IBD for all the member states. We run this panel so that there is an opportunity for immediate questions if you have some in mind, but then after the presentations we will have some time for general discussion, so you can also make your questions then. Are there any immediate thoughts, questions, comments from the audience? While you wait, may I make one? Since I work for the ministry, I have a background in academic hospitals, but today I'm more like public health issues come to my desk. How do you view the relationship of something being developed in a hospital environment and then supposedly being implemented to public health? You know, these communities are not always the best friends, but how do you manage this dilemma?
So it's a good question. You know, we work closely with some of the HMOs in Israel, which of course take care of the public health mostly, take care of the population health for their own insured people. And we have strong collaborations working on joint data between the hospital and the community, looking for these types of solutions. But I would say one thing in terms of regulation, when you talk about artificial intelligence, for example, we have, I think, more than 20 different artificial intelligence applications running, currently helping clinicians make better decisions. There's a question of whether that needs to go through regulation or not. What we have done is we have made our own internal committee which is driven through quality and patient safety. And we make decisions on whether to utilize artificial intelligence solutions internally for our own system. But if we want to take that out, of course, we need to validate and make sure that it works outside, and then, of course, go to the regulatory bodies. And many of the startup companies are aiming at the US or the European market are looking for the FDA or the CE. And already many of these solutions have received these approvals to go into the market. So we see them being widely implemented across a broad population.
Thank you very much. So it's not enough that you get something for yourself as a huge organization, but implementing it to the outside world is the final goal, I guess.
For sure.
Yeah. Thank you so much.
Thank you.